You can thank you. Let's try it. Please try 2 o'clock. You said most of the time you can shoot it.
Just a few questions. Just to educate Nigerians about COVID, where we are, the real idea behind our project is we want Nigerians to understand that the job of government is for both of us, the leaders and followers. Nigerians seem to believe leadership, not a meaning, you preach it the country. What's your own goal? That's the real thing behind it. So right now, we give face masks, we tell you what to do, we tell you that. If you don't do it, we bring it back to our table for us to take care of it. That's very simple way. The major question I have for you, where are you today? What are you vaccine? I don't want to ask question about identity. I don't want to because we've not said particularly what I'm doing. So I don't want to ask question about that. But I'm going to ask question about how do you relate SARS with Ebola? How come COVID is looking like Ebola? I want Nigerians to have some understanding in that regard. That I think that be the only question that is going to. And I'm dodging one of the origin of COVID. I want to talk less about it. I just talk about the science. And for those who do not have those major signs we talk about, how do you know when it happened? If you don't have it, how do you have to get it better? You know, there's no way enough to check it. You know, start sense and taste. That's all. I'm ready. Only for vaccine protection. Started already?
Yes.
Can we go? Good evening, Nigerians. This is Bode Olugbore, and we're coming to you live again from G2C interface, government to citizens interface. This is the medium we have created who has died. So that's what he said.
Yeah,
One person knows that.
well, there are two ways of about to look at it. The first question is, has everybody in that community or in that area been tested? That's it. And don't forget, you can be tested and be positive, but you have not manifested anything. So, for whatever, whether it is nature, whether it is whatever, whether it's your immunity that is strong enough as to be able to ensure that you don't contact. Because like I said, you can have the virus without necessarily coming down with the disease. They are two different. Now, or it could just be that, well, if the maybe so maybe the you see, as they say, the popular Shakespeare said that when beggars die, comments are not seen. Because by and large, the people that we know, they are the the ones that we found the people that the high and mighty in the society. Those are the ones that their deaths are reported. The people who are every life is important, but probably they are not well known and they just die quite patient. So nobody will be talking about that. You know, so many people high and mighty in society and have gone down with COVID, and those unfortunate have succumbed totally. They have died from this thing. So it would not be right for people to say that oh no, it's not. It is real. It is real.
Sometimes I wonder if some Nigerians are saying this time. Those who have died have actually just gone and retrieved their family back. In fact, that's the way it comes to me sometimes. But I want to know, sir, for those who are not taking this matter seriously, what can those who are serious, what can they do for now?
Well, it is to continue to let people know, and for people that have been down with it and are, if like for those people that have gone to the valley of the shadow of death and have come back, is for them to tell their stories and to let people, you see, because the experience, they say, is the best teacher. So if people come around after a very traumatic experience, COVID, and they're able to get over it, is for these people to come. And I have quite a number of friends as well that have been good enough to come. In fact, only in this COVID era, a friend of mine who was based in the medical school, now a professor of psychiatry in UK, I had to talk to him, and he sent a clip of himself to share for experience sharing, for knowledge sharing, for peer review. He recorded his experience and sent to us, and we played it at one of our sessions in the ministry. So that very early, he escaped death by the whiskers, if you like, and he shared his experience. And of course, as we have it now, more people are likely to even survive because we are getting more knowledge. We are getting more aware. The awareness is is better than before. So more people are likely to even survive COVID now than the people that survived it early when the whole thing was still very, very hazy, and the knowledge of it was very, very scanty.
Well, I understand, sir, that the African Union has ordered for 10 million vaccines, and Nigeria is seeking some. What's our plan?
More than 10 million. The African Union has more than that. More than 10. In fact, what we are asking for is more than 10 million.
Sorry, 270.
270. Oh, okay.
270. What's our plan?
Yes, you see, right now, we are having engagement and negotiations at various levels. At the bilateral level, that is government to government, our government to government of another country. Of course, we're having with the Russian government. The Russian ambassador has visited us, tell us about their own vaccine in Sputnik. We are interrogating them, and we are looking at yes, depending on the level of efficacy, depending on the level of safety, and of course, depending on the cost. Because these are some of the factors that we need to take on board before deciding. So we are having that engagement at the international level. At the multilateral level, you have mentioned the African Union. African Union through what we call EBAT. EBAT is African Vaccine Acquisition Task Team. That is EBAT. And that is being facilitated by African Union. And the whole essence of this is to be able to ensure that there is equitable distribution of vaccine and that African countries have access. As most of the African countries are low to medium income countries, so that we are not shortchanged in terms of access to the vaccine. So that's why we are having that agreement. And of course, don't forget, you are stronger together.
Yeah.
Yes, as come together as opposed to individual approach. So that's then the second multilateral approach is through what we call the COVAX. The COVAX is being facilitated by Gavi. Gavi is Global Alliance for Vaccine and Immunization. That has been the body, global body that has been responsible for getting us vaccines for our routine immunization against this childhood vaccine preventable diseases, polio, measles, and all this. So we also went through them, and of course they are also working in collaboration with WHO to try and source for vaccines for countries on a global basis. That's also a kind of engagement which we have. So we are looking at, and then we are not restricting ourselves to a particular vaccine. So because we don't have that luxury to pick and choose. For as long as we can establish efficacy, for as long as we can establish safety, for as long as, of course, we also have the cost, because cost element comes in. It's not free. There's no free lunch, even in free time. So what that means is that we have to take cognizance of all these factors and do what is best in the circumstance after taking all these factors that I mentioned.
And that's what vaccines would be possibly having.
We will need vaccines that will cover minimum of 70% of our population to be able to now move to a point that we can expect what we call herd immunity. That is a situation where we can feel comfortable to say that we have covered that we are reasonably safe, and that will now reduce transmission, if not interrupt and reduce the spread at that point. So of course you can then make your projection. If the population is about 200 million, 70% of that. And of course, again, depending on the vaccine we are using, you know that the vaccines that are very like Pfizer vaccine, Moderna, and other, they are two dose vaccine. That is, you take one, then then 3 to 4 weeks later you take the second dose. So which means that if you have 100 doses, that will only if it's 100,000 doses, that will be for 50,000.
But so today, I read somewhere that there's a particular vaccine that you need only one shot.
Yes, that's the Johnson & Johnson. That's why, again, you see, the advantages derivable from even arriving at development late. So, if right now there is scrambling all over the place, everybody is scrambling, and you even have the big countries who have all the money to throw around. They are mopping up the vaccines available now. But I know, just like in basic economics, they talk of demand and supply. Now, I do know that as time goes on, even the cost of these vaccines will go down. Because more vaccines will be developed, they may even be more efficient. They can even be more efficacious. And this is where this single dose thing comes in. Unfortunately, as at now, we have not been able to establish the level of efficacy, and then, of course, that is again how long will the immunity that is going to confer, how long will it last? These are also one of the things. We are better off if we can get a vaccine that we just apply one dose. Because of the challenges of getting people to come back. There are a lot of reasons why people will not come back to take the second dose. One, if which is dangerous because it's like starting a treatment course that you don't complete. It's not good. And if people have some reaction that they are not too comfortable with, they won't want to come back. You see? And even if they don't even have anything, some people they may just with their own account say, I've got a shot, I'm okay. Which is not true.
I feel better now.
So these are all the things that we're interrogating and we're saying that yes, if we get to that point and we're able to establish the efficacy, safety of any vaccine, Johnson and Johnson is one of the, but again, we need to be able to establish its efficacy level because all of these things will take on board for
Sometimes on
get that right and do the right thing for our common good.
A particular nation, I believe it's either Australia or New Zealand. If you do not vote during the election, the person goes to jail for not voting.
Oh,
And another nation also I
oh,
know in Europe
oh,
have been using traffic lights for many years, but they got to a point where they realized that they were morally obedient, bound by what is right.
that is
They removed all the traffic lights in the nation, and there's never any accident. So I think we're coming to the point where,
thank you very much. And that's the point I'm making.
where you need to,
Compliance.
you need to, let's comply. Let's even be decent Nigerians.
The society will be better for it. The society will be better for it. It's for the good of us all. That's just it. That's just what
Because of your time, I have a few people who should be making contributions online. I'm sure they are there. I don't want to say I apologize to you because I'm going to listen somehow to you. Dr. Adeola Lemboye, Assistant Professor of Psychiatry, Cummings School of Medicine, the University of Calgary. She's there. She's there, right? Dr. Agbor Ebuta is there also. I don't know if I can pick them, but give me a second. Can you pick them? Can you pick their voices?
Dr. Ebuta.
Yes, Ebuta.
Yes, sir.
Let's start with Ebuta. I want to make sure that you
Yes.
see it.
Hello, how are
Yeah.
you?
Very well, thank you.
It's been an interesting discussion. I've followed a very senior colleague, Honorable Minister of Health for State in Nigeria, Ekushesa.
Thank you very much.
Yes, sir. Okay, I don't know. He said so much, and I think he's touched on a lot of things you wanted me to contribute. So I don't know what to do really. What do you want me to do now? Hello.
You well. Can you pick the microphone and put it there?
Okay.
I can't hear you well. Ebuta.
Oh, you can't hear me well.
Yeah, throw the question again.
Okay, I said the honorable minister has really touched on certain things, and I was thinking you had said you would want me to comment on the virology, and you
Yeah. I
also
wanted you to say
on
something about
the,
virology.
well, I think I will just highlight some points that would be very useful going forward. The first thing is that yes, we do have new strains. These new strains, it's already out there that that information is out there that they are much more easier to transmit, and that it appears that the pattern of disease seems to be worse because we are seeing more morbidity, that is illness, and we seem to have seen a spike in death rates, and we are presently seeing much younger people come down with significant illness requiring admission. You can hear me?
No, you go on. I'm sure the people online will hear you.
Okay, great. Yeah. So it's important to also remember that our population dynamics actually is more like one of the factors that may have explained why, comparatively to some of the Western nations like in Europe and in the Americas, we have not seen the kind of percentage death rates that are reflective over there. If you look at the fact that the Nigerian population, for people that are 65 years and above, they only constitute about 7% of the Nigerian population. So we basically have a significantly young population, and that in itself is a factor. The other issue, obviously, I would also want to point again is that when it comes to patient the risk of patient infectivity, roughly 9 days after patients are tested positive, 9 days from that, up to 99% of these patients cannot infect, meaning that if you were to test them, they would test positive, but the viruses that are testing positive are actually dead at that point because positivity, PCR positivity is persistent for as long. Mean positivity is probably 17 days. And we've had patients that have stayed positive for up to 83 days. But the evidence is strong that by the ninth day, following the first test after symptomatic manifestation of symptomatic presentation, most people are not infective. 99% are not infective. This is important because we need to share this information to strengthen people and to remind them that isolation is not directly related to PCR positivity. And that is important also because we need to also diffuse anxiety. You have a significant percentage of patients who consistently test positive, and because of that, they are worried even if they are not infected. So that's important. We need to get that out there. The third thing I would also want to mention is that yes, indeed, there are several vaccines, and for us to mobilize public opinion I would consider myself a frontliner because I basically see patients. I practice at the sideline, so I basically see patients who are positive and who are symptomatic. So there's a lot of apprehension about the vaccine, and it has to do with the information sharing. We already have people who are natural influencers in our community. We have pastors, we have imams. These people, to a large extent, influence public opinion. So I think, thank God, our honorable minister is here. I think there should be a platform that allows the imams, the traditional rulers, the pastors, the religious people. I think you should convoke, I think Otumba Olugbore, you should convoke a meeting of all the pastors in this country, all the imams in this country, get them to sign up on Zoom, and let's have this discussion. I'm sure that Honorable Minister will be able to facilitate the dissemination of that information. We need to get these people on board. They need to be on the same page with all of us because for some of us that actually see patients that have died, it's very pitiful when we see some brokers with religious or of religious origin that are skewing, skewing the message about whether this virus is truly there or not. So it's important for us to get that out. The other thing I would want to comment is that maybe
Be careful.
We've had we've had several vaccines created in Nigeria. We've had the smallpox, the chicken pox, no, the oral polio vaccine. I think Nigeria has a patent for that, and one or two other vaccines that we've made inroads to. I think this is an opportunity. I understand government is going to shade out some money. I don't know, 10 billion thereabout for vaccine. Honorable Minister mentioned something about that. I think it's critical that we get the message out there and we pump money into this activity. The other issue is that there have been claims that we intend to vaccinate 70% of our population. I know for certain that that will be prioritized. Obviously, we will start with frontliners, people who are likely to fall ill, who are to have poor outcomes. And in fact, I also think that if we are going to vaccinate 70%, that's a lot of money. That's a lot of money. Even if we vaccinate, even if we are able to vaccinate 30% of our population, which will account for most people that are 54 years and above, it will be a major boost to the fight. The last thing I want to say. Thank you.
I'm very grateful to you. Let me see. I don't know, is Dr. Adeola from Canada, Adeola Lemboye, is she there? She's not there. I see her, right?
Yeah. I'm there, hi.
Yeah, can you take 2 minutes, Dr. Adeola?
Oh, thanks for having me. And yeah, it's nice listening to the Honorable Minister. And I actually took down some notes. I'm really impressed with all the new initiative and, the ideas that the minister has shared. The one that really struck me is the voluntary compliance, which is very applicable to the COVID situation, but as Nigerians, we need it for other aspects. And if we can achieve part of that, as citizens, then, we would definitely succeed in different ways. So I'm a psychiatrist and also a frontline worker, and I treat COVID positive patients. And the unit I work on in Calgary, Alberta, it's declared the COVID Center of Excellence. So I have some insight into the suffering of the people, that have COVID, and not just the patients, but even their relation and how it impacts the community. So I just want to say a few words about the mental health implication, effects of COVID. And as the minister rightly defined health, it's a state of complete well-being, not just physically, but mentally. It's so important, and even when it comes to the COVID infection itself, it's been shown that, and I've seen, the medical complication of the illness itself and the aftermath, the complication. So there's been research and there's been, presentation of COVID psychosis, COVID anxiety-related disorders, and things like that. We're beginning to see more, right? But the effect of the complication includes bereavement. A lot of people have lost loved ones, and even the way it happens, it's so traumatizing because they cannot spend time with this loved ones, because they have to be socially distanced from them. They cannot, do the normal, spend their last times with them, which can be very traumatic, and so a big loss and grief, and the effect of social isolation, it's unbelievable. I mean, people are, socially isolated and they just can't connect with their loved ones. I mean, we have the virtual platforms, which is great, but it's still not the same. Like, where I live, there we have elderly people. Most of the populations there, they're like elderly people, and they depend on community support and relationships to survive. So we can see the effect of social isolation, which has increased incidence of depression, anxiety, and even suicide. Loss of income. People have lost their jobs, their means of livelihood, their businesses, and we can see how that has ripple effects. They're losing their homes and things like that. But thank God the government is putting things in place to alleviate some of those sufferings. We've seen incidents of domestic violence. People, because they're just stuck at home, they've lost their job. There's a lot of, friction between relationships leading to violence. And, we've seen incidents of fear and anxiety. There's